Hello everyone. Today, we're exploring the medication known as Sinemet, which is a combination of carbidopa and levodopa. As always, this discussion is for educational purposes. For health-related concerns or questions, it's essential to consult a medical professional. Description: Sinemet is a combination of carbidopa and levodopa. It is primarily used to treat symptoms of Parkinson's disease, such as muscle stiffness, tremors, spasms, and poor muscle control. This condition may arise due to low levels of a chemical called dopamine in the brain. Additionally, Sinemet is prescribed to treat Parkinson's symptoms caused by carbon monoxide poisoning or manganese intoxication. Warnings: you should not use Sinemet if you have narrow-angle glaucoma. Additionally, avoid using Sinemet if you've taken an MAO inhibitor in the past 14 days, including drugs like isocarboxazid, linezolid, methylene blue injection, phenelzyne, or trenylcypromine. Before taking this medicine, it's crucial not to use Sinemet if you're allergic to either carbidopa or levodopa. Before starting on Sinemet, inform your doctor if you have narrow-angle glaucoma, used an MAO inhibitor in the past 14 days, heart disease, high blood pressure, or a history of heart attack, liver or kidney disease, an endocrine, hormonal disorder, asthma, COPD, or other breathing disorders, a stomach or intestinal ulcer, open-angle glaucoma, depression, mental illness, or psychosis. It's worth noting that individuals with Parkinson's disease may have a higher risk of skin cancer, melanoma. If you're pregnant, planning to become pregnant, or breastfeeding, consult your doctor. Additionally, the disintegrating tablet variant of Sinemet may contain phenylalanine, so inform your doctor if you have phenylketonuria, PKU. Dosage: always take Sinemet as prescribed by your healthcare provider. If you've been on levodopa, you must stop taking it at least 12 hours before starting Sinemet. Sinemet can be consumed with or without food. The tablet may sometimes be broken in half to achieve the correct dose. Always swallow it whole or half without chewing or crushing. It's essential to note that it might take several weeks for Sinemet to show its effects. If you're using Sinemet for the long term, regular medical checkups are advised. The recommended dosage and frequency vary based on individual needs and the specific condition being treated, so always adhere to your doctor's instructions. Side effects: like all medications, Sinemet can cause side effects. Some of the potential side effects include uncontrolled muscle movements in the face, worsening of tremors, severe or ongoing vomiting or diarrhea, confusion, hallucinations, or unusual mood changes, depression or suicidal thoughts, severe nervous system reactions like rigid muscles, high fever, sweating, confusion, fast or uneven heartbeats, and tremors. It's also possible for some people on Sinemet to fall asleep during regular daytime activities. If you notice any unusual side effects or symptoms, it's crucial to consult your doctor immediately. Interactions: Sinemet might interact with other medications. Always inform your doctor about all the medications, supplements, and herbal products you're currently taking. Avoid: while on Sinemet, avoid driving or engaging in hazardous activities until you're sure of how the medication affects you. Avoid rising too quickly from a sitting or lying position to prevent dizziness. It's also recommended to avoid iron supplements or a high-protein diet, as these can interfere with the absorption of Sinemet. FAQ: Sinemet's effects begin to show within about 20 to 50 minutes for the short-acting formulation, while the long-acting formulation starts working closer to the 50-minute mark. The frequency of dosage varies based on the specific formulation and individual needs. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing: that concludes our overview of Sinemet. Remember, this information is intended for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.